Today we're going to discuss GERD, G-E-R-D, gastroesophageal reflux disorder or disease. What happens with GERD, better known as heartburn or acid reflux, is acid goes up your esophagus, into your throat, into your mouth. In fact, 25% of the time, people that have chronic sinusitis actually have acid reflux issues. So look at the word sinusitis, inflammation of the sinuses. Well, I can guarantee you acid's going to do that. Likewise, pharyngitis, tonsillitis. Maybe you have a raspy throat in the morning. Maybe you have really bad taste in your mouth because partially digested food has came up in your throat. You really want to look at taking charge. You don't have to have the classical, what shows up on the commercials on television, symptoms. You don't have to have heartburn to have acid reflux. It could be silent 50% of the time. You don't even know it. Every once in a while you have a bad breath, you notice a little food in the back of your mouth, and or you just notice, hey, my tongue doesn't have all this papillae or taste buds. The reality is acid reflux can be very clandestine, and there's certain things you can do naturally to take charge so that you don't have to suffer the sequelae. Unfortunately, in my clinical practice, I've seen tongue cancers, throat cancers, all from acid reflux. It's not something to fool around with, and there's some simple things that you can do proactively to take charge, control another risk factor in your life with some simple interventions. First off, do not do too much caffeine. Caffeine's okay in moderation, unless you're super sensitive, but the reality is if you do it past about 2 o'clock, 3 o'clock in the afternoon, the tone of your lower esophageal sphincter, if this is your stomach, this is the lower esophageal sphincter, and this is my esophagus, the tone's not going to be there, and you're going to percolate like an old coffee pot from the 1950s. You don't want to be percolating all night long because the acid comes up the throat, the mouth. As a result, you end up with big problems. So the other thing what you want to do is if you've gained weight, the intra-abdominal pressure is going to cause more upward pressure, pushing up on the stomach, pushing up on the esophagus. That's not a good thing. So you kind of want to look at tone, you want to look at weight, and you want to make sure you do not use peppermints, mints of any sort, because they also relax that lower esophageal sphincter. It's going to cause more reflux. That lower esophageal sphincter is a band, a muscle. As long as it's taut, no problem. Otherwise, if it's loose, acid's going to come up. So peppermint, mint, definitely if you're going to do like a peppermint mocha, you're going to be double whammy. You're going to have caffeine and you're going to have mint, not a good thing. Likewise, mint and peppermint tea also going to be problematic. You go to a fancy steakhouse, what do they give you after you eat? A mint. Mints are naturally carminative. They increase acid production, increase acid processes in the body. That's not good in the case of people with acid reflux. Likewise, do not drink or eat 2 to 3 hours prior to bed. No liquids whatsoever, 2 to 3 hours prior to bed, and no food. Why? Because once again, your stomach's full opposed to empty, so now you lay down and that liquidity goes up into your neck and into your mouth. Don't want that. You want to go to bed with an empty stomach unless you have some weird blood sugar issues going on, because it's actually going to be very problematic for your long-term health. Lack of digestive enzymes is also a huge issue. I encourage all my patients with acid reflux to use digestive enzymes with their meals. So often we're told that it's excess acid. Rarely is it excess acid. Sure, you can control symptoms with acid blocker, whether it be prescription or over-the-counter, or Tums, but the reality is it that you're just not digesting your food sits there, and now it's coming up your throat because it's not done with this job. You go to bed, and instead of staying in your stomach and going down to your small intestine, it's going up your throat. Digestive enzymes can help a lot unless you have an overt ulcer. So if you have a big ulcer in your stomach, don't do a digestive enzyme. Otherwise, digestive enzymes are what I call the cat's meow when it comes to acid reflux. The other thing is, if you have gastritis or an ulcer, you must ask your doctor to get an H. pylori test. An H. pylori test measures for the little bacteria that causes ulcers. So often people are being treated for ulcers, upset stomachs, and they have this little bacteria that if it's killed, wouldn't be a problem, whether it be using something natural like mastic gum or DGL, or using an antibiotic to kill it. You get rid of the problem. It's much like getting rid of a splinter. I can say, what's wrong to everybody that's watching? What's wrong with my finger? It hurts. And someone will say, take some Advil, take some Tylenol, put some ice on it. Somebody might even say, chop it off. Well, I can say, but can I just remove the splinter? You need to figure out why you have acid reflux, when has it gotten worse, what's made it worse, and then take charge and address it from that perspective. So use digestive enzymes, can definitely help. Eat smaller meals, and definitely make sure that the meal right before bed is not huge, and put that 2 to 3 hour space between the drinking and eating and going to bed. You can also take calcium after you eat because calcium acts as a natural buffer. Likewise, avoid carbonated beverages after about 2 to 3 o'clock in the evening or afternoon. Use DGL, deglycerized licorice. DGL often comes in a chewable form, and it actually has been shown in some studies to be as effective as cimetidine or Tegament, which was an old acid blocker. So what it does is it helps coat with mucus your lower stomach, and you need mucus for a healthy GI tract. Otherwise, irritation will occur. And of course, you can always use conventional drugs for, of course, treatment. And sometimes you have to do that until you address the underlying cause. So digestive enzymes, calcium, addressing whether you have H. pylori, very important. And remember, if you're using an acid blocker, you're using a prescription and or over-the-counter acid blocker, you will increase your chance of becoming B12 deficient, calcium deficient, iron deficient, lower your biotin and B5. So doing a good multivitamin, doing some extra B12, and looking at increasing your calcium is important. So if you're going to go the conventional way, at the very least, B12, iron, a multivitamin to buffer that, as well as calcium, because you need stomach acid to absorb. So the take-home message is this: take charge of your health. Don't let your stomach get the better of you. And remember that you count on your stomach to digest your food. And you need to make sure that you're taking care of it, because otherwise, with no food, of course, there's no us. So take charge today. Remember, digestive enzymes, small meals, don't drink before you go to bed. And I encourage you to devour life instead of having life devour you.